Hi, I'm Dr. Peter Ang. I'm a medical oncologist at OncoCare Cancer Centre, Singapore. Today I'm discussing a breast cancer topic relating to younger women with breast cancer. Now, younger women refers to premenopausal breast cancer patients who are often less than 40 years old. At OncoCare Cancer Centre, we often see patients even younger than that. Epidemiologically, younger breast cancer patients are often underrepresented in studies of Western patients where the average age of breast cancer is in their 60s. In many Asian countries, breast cancer onset is actually younger. A recent epidemiological study has shown that outcomes are actually worse for younger patients with breast cancer. And there are different issues of detection of breast cancer, treatment, potential side effects for these younger patients. For detection of breast cancer in younger patients, it can be more difficult, especially when mammogram, which is the main screening modality in many countries, is used. This is because the breast is often denser in younger patients on mammogram, which will make it more difficult to read. Sometimes, MRI breast or ultrasound may have to be used. In addition, doctors or the patients themselves may not suspect that the patient has cancer because the patient is young. Care would therefore have to be used in screening these patients. Breast cancer is now divided into several different subtypes based on the expression of endocrine or called hormone markers in the pathology specimens of the cancer. Younger breast cancer patients tend to develop a slightly more aggressive subtype that are hormone negative, and this is what we call triple negative breast cancer or HER2 positive breast cancer. These cancers have unfavorable prognostic features and tend to spread early. Modern genetic and genomics techniques allow us to study the tumor better and to plan treatment together with the patient. Age and patient choices would affect patient decisions on surgery, reconstruction options after operations, as well as radiation. And they may choose different options compared to older patients. There are also options to avoid chemotherapy in some lower risk hormone-positive breast cancer patients. This may be important for patients who are working or who have young children to look after. Other issues of hair loss and fatigue may actually impact a younger patient much more who has to work compared to an older woman. Scalp cooling to reduce hair loss can be a suitable option for discussion in some patients if they do need chemotherapy. For advanced cancer patients, besides traditional use of chemotherapy and endocrine therapy, there are now other drugs with different mechanisms of actions against the cancer. Drugs such as CDK4/6 inhibitors, targeted therapies such as Herceptin and pertuzumab antibodies, immunotherapy, PARP inhibitors. These are medications that are recently used and specifically identifying some patients who have a germline BRCA1 or BRCA2 mutations, which occur more commonly in younger patients, may affect the choice of such treatments. Difficult cases are often discussed together with the treating surgeon, radiation specialist, the pathologist or radiologist, bringing our multidisciplinary expertise together. Concerns of fertility and early menopause should also be addressed. I do discuss this with my younger patients, particularly if they do need to go on chemotherapy. On the other hand, younger patients do also need to be reminded not to become pregnant when they are on certain medications. Now, sporadic breast cancer or general population risk is still the main cause of cancer. Family members also do share common environmental exposure. But having said that, a breast cancer family history is a risk factor for breast cancer, and obtaining an accurate family history is important. When there are multiple cancers in the family, such as breast and ovarian cancer, it can suggest cancer risk related to hereditary breast cancer. Patients may also not suspect that the risk may come from the paternal or the father side of the family. In these cases, when there is a risk for hereditary breast cancer, genetic testing following careful counseling of the patient is available, and patients should consider that as an option. First of all, most of our foreign patients should know that almost all our treatment for breast cancer occurs in an outpatient, comfortable setting at OncoCare Cancer Centre. We have several clinics all over the island, and for patients on chemotherapy, they would be advised to stay with us for a few days, especially for the first cycles. Now, several studies of early breast cancer show that late relapses do occur, particularly in hormone-sensitive breast cancer. We do journey together with our patients, and so younger patients would definitely need a longer time of follow-up in case a second cancer does occur. This risk is elevated, particularly if they have a family history or known to have a susceptibility genetic mutation. However, when patients are well for several years, the follow-up interval is usually rather long, after several months or maybe even a year. I hope that you have found our segment on younger patients with breast cancer informative. If you do have any questions, do not hesitate to reach out to us and contact us via our website or make an appointment to see us. We'll be happy to see you.